Now let's talk about what it's like to be a freelancer versus an employee regulatory medical writer. So what skills do you need? You need to be able to read a lot of information in a short period of time and understand it, and then write about it accurately and transparently, so you are not misleading the person who's reading the information. You also need to understand the rules, so the difference between writing for a clinical trial, writing for a healthcare professional, and writing for a patient or the public. So, how easy is it to get in? So, it can be more challenging if you want to get in as a freelancer because a lot of companies and agency are really concerned about information getting out. So, they need to really be able to trust you with the information that they give you, and they do not want you to be working with competitors. So, it can be easier to get in as an employee at an entry level. And usually, if you want to get into regulatory medical writing, you might need an advanced degree. So you will be at an advantage if you have a master's or a PhD and you want to get into regulatory medical writing. So you will need to go through the employee route to have the best chance. But if you are a freelancer and you've had a few years of experience as an employee already, then you should be able to get in even if you don't have a master's or PhD. So where will you work and who will you work with? You might be able to work from home and you might be able to work sometimes in the office, or you can choose to work full time in the office. So it really depends on who you end up working for and what your client prefers. So some clients might want you to log in to a specific place and you can only use a specific laptop, for example, and they want to keep all of their intellectual property under lock and key, so keeping it very secure. So you might work with a really big team depending on the client, or you might work with a really small team if you are in a small agency. You will likely work with other medical writers, people who are reviewers, people who have been part of the legal team for the client, and you will also need to work with probably healthcare professionals and other experts. And you might also work with patients as well if you're working on consent forms and people who have lived experience of the condition that you are writing about. So, how long does a project last? A project will last a few months and it could last a couple of years. So, if you like working on projects that last a really long time, then regulatory writing would be ideal for you. If there are marketing campaigns, so there's more medical communications, then it can take a long time for those to actually be approved before you can use them. And that's what adds to the time. And this is another reason why people want to get into regulatory medical writing, because once you start on a project, you will likely be on it for a very long time. So it's nice, stable income. So how long will a client stay with you? So they can stay with you a few months and then they can stay with you for many, many years. So some people have clients for 10 years or longer if it's regulatory medical writing, because again, it's about building that trust. So if you do develop the skills and you get the training to become a regulatory medical writer and you understand all of the rules, then it can be something that it becomes a stable source of income. So can you add your work to your portfolio? No, usually you cannot because you need to sign a non-disclosure agreement or an NDA, which I mentioned earlier. And this means that you cannot really talk about your work or what you worked on, but you can say that you worked in a specific condition category. So, for example, some people say, oh, I worked on a project where we looked at a rare disease, but you can't say what the disease is because it's rare and it will be too obvious if you do say what it is. And some people might say, oh, I worked in oncology. So you worked in some kind of area of cancer, or hematology, which concerns the blood, and other things like that. So you'll usually have to be quite vague, but what you can do is you can talk about the types of documents that you created, and you can also talk about how you helped a certain medicine get to market, or how long you worked on that project, and who you worked with as well. So again, focusing on the skills that you developed rather than the actual work that you created. Can you work with competitors? The answer is probably not, because if you are a freelancer, they do not want you sharing information with a competitor. So it's really important that you read your contract before you sign anything as a freelancer. And then also as an employee, if you work with an in-house team, so you are employed by a company that is working on a really big potential medicine, then they might say that they do not want you to work with a competitor for the next maybe 2 to 5 years. So it can be a really long waiting period. So if you lose your job and you've developed all of these skills in under a specific health condition, then you can't take those skills anywhere with you. So do read your contract before you sign anything.